Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. Today, I'm going to be spending some time with you talking about the symptoms of diabetes. And this is a continuation to the video I released last week on the types of diabetes and the factors that can put you at risk of developing diabetes. I'm going to leave the link in the description box below so you can check it out if you haven't yet seen it. Diabetes symptoms vary depending on how much your blood sugar is elevated. Some people, especially those with prediabetes or type 2 diabetes, may sometimes not experience any symptoms at all. In type 1 diabetes, symptoms tend to come on quickly and can be more severe. If symptoms of diabetes are recognized on time and dealt with, then complications can be avoided. Today, we are going to talk about some of the common symptoms that occur in both type 1 and type 2 diabetes. And these are symptoms that occur in both men and women. I'm hoping this will help most people learn and seek the necessary medical attention on time. Some of the common signs and symptoms of both type 1 and type 2 diabetes include increased thirst, also known as polydipsia. Polydipsia is one of the initial symptoms of diabetes. We all get thirsty at various times during the day. Adequate daily intake of especially water is very important, as water is essential for many bodily functions, including regulating body temperature and removing waste. However, if you feel thirsty all the time, or your thirst is stronger than usual and continues even after you drink, it can be a sign that not all is well inside your body. Increased thirst can be caused by various things, but can also occur as a result of high blood sugar levels in people with diabetes or yet to be diagnosed diabetes. The symptoms of polydipsia are recognized as having persistent and unexplained thirst, regardless of how much you drink, and passing more than 5 liters of urine a day. If you have diabetes and experience increased thirst for a number of days, you should make an appointment to see your doctor or the healthcare team. If you don't have diabetes, you should see a doctor if the reason for thirst cannot be explained, and particularly if you have other symptoms of diabetes. Frequent urination, also known as polyuria, is another symptom of diabetes. Polyuria is defined as the frequent passage of large volumes of urine, that is more than 3 liters a day, compared to the normal daily urine output in adults of about 1 to 2 liters. It is one of the main symptoms of both type 1 and type 2 diabetes and can lead to severe dehydration, which, if left untreated, can affect your kidney function. As well as being one of the symptoms of undiagnosed diabetes, polyuria can also occur in people with diagnosed diabetes if blood glucose levels have risen too high. If blood glucose levels become too high, the body will try to remedy the situation by removing glucose from the blood through the kidneys. When this happens, the kidneys will also filter out more water, and you will need to urinate more than usual as a result. If you are frequently experiencing an increased need to urinate, it could be a sign that your sugar levels are too high. You should consult your doctor if you have excessive urination over several days that cannot be explained by an increase in fluids or medication. The third symptom is excessive hunger or polyphagia. Polyphagia is the medical term used to describe excessive hunger or increased appetite, and it is one of the 3 main symptoms of diabetes. An increase in hunger is usually a response to normal things such as intensive exercise or other strenuous activity. But polyphagia can also be the result of more severe issues, such as depression or stress. The main sign of polyphagia is excessive hunger that doesn't go away by simply eating more food or eating more regularly than normal. In uncontrolled diabetes, where blood glucose levels remain abnormally high, glucose from the blood cannot enter the cells due to either a lack of insulin or insulin resistance. So the body can't convert the food you eat into energy. The lack of energy causes an increase in appetite. Simply eating will not get rid of the hungry feeling of polyphagia in people with uncontrolled diabetes, as this will just add to the already high blood glucose levels. The best way to lower blood glucose levels is to exercise, as this can help to stimulate insulin production and reduce blood sugar levels. If you're worried by your sudden increase in appetite, you should consult your doctor. They will examine you to check whether your hunger is a symptom of diabetes or another medical condition. Apart from these three major symptoms, that is polydipsia, polyuria, and polyphagia, there are other symptoms, and these include fatigue. In the medical world, extreme tiredness and exhaustion that doesn't disappear with rest or sleep is known as fatigue, and this can be a symptom of diabetes. Symptoms of fatigue include a lack of or no energy, difficulty in carrying out simple everyday tasks, feeling down or depressed, and this is also known as mental fatigue. Diabetes can cause sudden and extreme tiredness as one of the main symptoms, and this can result from high blood sugar levels caused by a lack of insulin or from insulin resistance. This can affect the body's ability to get glucose from the blood into cells to meet our energy needs. People on stronger diabetes medication, such as insulin, may also experience fatigue as a symptom of low blood glucose levels. If you're suffering from extreme tiredness that is not simply due to a lack of sleep or has gone on for 3 to 4 weeks, you should seek medical advice from your doctor or make an appointment for a checkup. Another symptom is slow healing wounds. When you cut or burn yourself, your body can repair the damaged skin. Some wounds heal easily, whilst others take longer, particularly if they are severe or the individual has a poor state of health. High levels of blood glucose caused by diabetes can over time affect the nerves and lead to poor blood circulation, making it hard for blood needed for skin repair to reach areas of the body affected by wounds. This can cause them to remain open and unhealed for months, increasing the risk of infections. Keeping blood glucose levels under good control can help to reduce the risk of slow healing wounds. Slow healing wounds can be a symptom of undiagnosed diabetes, particularly if other symptoms are also present. If you do not have diabetes and a cut or burn is taking a long time to heal or showing signs of infection, consult a healthcare professional to have the wound examined. And because of the risks of amputation, it is important that if you have diabetes, you consult the healthcare team if you have any signs of damage to your feet. Wounds on the feet or any other part of your body should be closely monitored. Another symptom is dizziness. Dizziness is an episode of unsteadiness and unbalance as a result of something affecting the brain or ears. A dizzy spell can be brought on by many things, but in cases of diabetes, the most common cause is dehydration. High blood sugar levels can cause polyuria, which is frequent urination, and this can result in dehydration. With low levels of water in the body, the brain may struggle to function correctly and cause lightheadedness. If you're suffering from bouts of dizziness that are recurrent or persistent, you should go and see a doctor. Unexplained weight loss is another symptom. Unexplained weight loss is a term used to describe a decrease in body weight that occurs unintentionally and can be a warning sign of diabetes. The amount you weigh is determined by a number of factors, including your age, your calorie intake, and overall health. Unexplained weight loss means weight loss that occurs without trying through dieting or exercising. Losing or gaining a few pounds here and there is normal, but unexplained weight loss that is significant, that is if you lose 10 pounds or 4.5 kilograms or more, or over 5% of your body weight, may signal an underlying medical condition. In people with diabetes, insufficient insulin prevents the body from getting glucose from the blood into the body cells to use as energy. When this occurs, the body starts burning fat and muscles for energy, causing a reduction in overall body weight. If you have unintentionally lost more than 5% of your normal body weight, or more than 10 pounds or 4.5 kilograms in 6 to 12 months or less, you should consult your doctor, as an undiagnosed diabetes could be the cause. Another common sign of diabetes is blurred vision, and it is described as the loss of sharpness of vision and the inability to see fine details. Blurred vision can affect one eye or both eyes and can occur often or rarely. High levels of blood sugar resulting from diabetes can affect your ability to see by causing the lens inside the eye to swell, and this can result in temporary blurring of eyesight. Blurring of vision may also occur as a result of very low blood sugar levels, and if this is the case, your vision should return once your blood glucose levels have returned to the normal range. If your vision has become blurred over time, it could be a sign of an underlying condition, which could be diabetes, amongst other possible causes. Also, if you are experiencing sudden blurred vision together with eye pain, you should go see your doctor and have your eyes checked. Genital itching is another symptom. And genital itching is a term used to describe itching, burning, or redness in and around the vagina or penis. Genital itching in both males and females is an irritating problem and can simply be caused by allergies and skin irritations, or by a more serious disease such as diabetes. Genital itching and burning can indicate a female or male yeast infection. Regular yeast infections are a sign of type 2 diabetes. This occurs as a result of abnormally high blood glucose levels, which can provide ideal conditions for naturally present yeast to grow, and also diminishes the body's ability to fight infections. Diabetes can also cause a high glucose content in the urine, another extremely suitable place for yeast to thrive. If you have genital itching that does not disappear after a couple of days or more, talk to your doctor or another healthcare professional. Failure to seek professional medical advice could lead to further problems, such as spread of infectious disease through close body contact, or a secondary skin infection, or could mean an underlying disease, such as type 2 diabetes that is left undiagnosed. Nausea is also another symptom. Most of us will be familiar with the feeling of nausea, which is basically the feeling of needing to be sick, felt in the stomach area. Both nausea and vomiting can be a sign of a number of underlying health conditions, including diabetes. Both type 1 and type 2 diabetes can cause nausea and vomiting in several ways. As the blood glucose levels rise and fall, the body's metabolism can get interrupted and confused, which can lead to a mixed feeling of nausea. The side effects of a lot of drugs is the feeling of nausea and even vomiting. Metformin, the most widely used diabetes drug, can cause nausea. If you are having recurrent or consistent bouts of nausea or vomiting, then it is a good idea to go and see your doctor to get the issue sorted as soon as possible. The symptoms of diabetes in men and women are generally similar, but there are certain symptoms which are either unique to men or maybe more noticeable in women. Symptoms specific in women include thrush and yeast infections, itchiness around the vagina, and female sexual dysfunction. And symptoms of diabetes specific to men include reduced strength from loss of muscle mass, recurrent episodes of thrush around the genitals, itching of or around the penis, and erectile dysfunction. So today we have spent some time talking about the symptoms of diabetes. If you are experiencing any of these symptoms and it's not going away, then I would advise that you make an appointment with your doctor and have a word with them. I hope you have learned something today. Please give this video a thumbs up and also share the information with family and friends. Please don't hesitate to hit on the subscribe button and also on the notification bell so you don't miss anything that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.